Hello, welcome to Elite Nurses channel. Today we are looking at some of the NMC examination past questions. Thinking of doing this in episodes, so this will be episode 1. I don't want us to do so many things at a time. Like, we should take our time and then go through each question so that we all understand. If you think there is any mistake in any of our answers, just drop it down. But this is the approved questions. You just drop down your reason for saying that and then you look into it. Yeah, so we'll be doing 8 questions today. So probably our next video will be doing 8 or 10. Yeah, but not above 10. If you like what I'm doing, type below like it's a good idea. So we just learn the past question together. I hope this be of help to some of us. Okay, so our first question is: a nurse is caring for a client scheduled for removal of the pituitary gland. The nurse should be particularly alert for. We have the objectives to be: A. Nasal congestion, B. Abdominal tenderness, C. Muscle tetany, and then the D. Oliguria. So looking at this question, we are doing pituitary gland removal. What do you think is related to that one? Abdominal tenderness does not relate to the removal of the pituitary gland. Muscle tetany does not also relate to the removal of the pituitary gland. Oliguria is not also related to the removal of the pituitary gland. But we all know that removal of the pituitary gland is usually done through the transsphenoidal approach. That is through the nose. So nasal congestion further interferes with the airway. We all know from our ENT where the pituitary gland is located. It's located somewhere at the upper respiratory tract. So we know that a nasal congestion is related to that one. So the nurse is supposed to be alert for nasal congestion. Yeah, so that is the correct answer. Okay, so our second question is: a client with cancer is admitted to the oncology unit. Start lab values reveal AGB to be 12.6, the WBC to be 6,500, the potassium ions to be 1.9, uric acid 7.0, sodium ions 136, platelets 178,000. So the nurse evaluates that the client is experiencing which of the following? We have A. Hypernatremia, B. Hypokalemia, C. Myelosuppression, D. Leukocytosis. So this question, you don't have to waste much time here. Just move to the objectives and then look through the possible answers. So A is hypernatremia. That means that the sodium levels should be higher than normal, and we know that the normal values for the sodium ions is 136 to 145 millimole per liters, and from the question we have 136, so that means it's normal. Then let's move to B. We have hypokalemia, deals with the potassium levels, and hypo means it should be below the normal values, and we know that the normal values for the potassium levels is 3.5 to 5.0 millimole per liters. And from our question, we have 1.9, which is below 3.5. So this could be our possible answer. If time is beating you, don't wait. Just choose your answer. You are correct. But if you still have much time, analyze all the possible answers. We have C, myelosuppression. Myelosuppression is a condition whereby the bone marrow activity is decreased, resulting in fewer blood cells. It could be the platelets, the WBC, the RBC. So when you look at the WBC here, the white blood cell count here is normal. The platelet is also normal. So this one is not part of our answers. And we have leukocytosis. Leukocytosis is whereby there is an increase in the white blood cells above normal values, but you have normal white blood cells count here. So our answer is B, hypokalemia. Okay, so our third question is: a 24-year-old female client is scheduled for surgery in the morning. Which of the following is the primary responsibility of the nurse? We have A, taking the vital signs, B, obtaining the permit, C, explaining the procedure, and D, we have checking the lab work. Okay, so from all these possible answers, we can see there is only one responsibility of the nurse in this question, and that is taking the vital signs. The other possible answers are the responsibility of the doctor. So that is not the responsibility of the nurse. It's not the responsibility of the nurse to obtain the permit explain procedure to the patient. That's the work of the doctor and also lab checking. So our correct answer is A. So our question 4 is, the nurse is working in emergency room when a client arrives with severe burns of the left arm, hands, face and neck. Which action should receive priority? We have A, starting an IV, B, applying oxygen, C, obtaining blood gases, and D, medicating the client for pain. All these are necessary. When the client arrives with the pain, with burns in the neck, we know it can affect the airway, right? So it can affect the airway, leading to difficulty in breathing, which can result in death. We apply oxygen to that patient. So the correct answer is applying oxygen to the patient, which is B. Okay, so our fifth question is, the nurse is visiting a home health client with osteoporosis. The client has a new prescription for alendronate, that is Fusamax. Which instruction should be given to the client? We have A, rest in bed after taking the medication for at least 30 minutes. We have B, avoid rapid movement after taking the medication. We have C, take the medication with water only. We have D, allow at least 1 hour between taking the medicine and other medications. So we know that Fusamax is a drug that is used to treat osteoporosis in men and in post-menopausal women, if I'm right. Yeah, and it's taken through the mouth, so it's with water only. But then if you give it to the patient has to stand, remain upright for at least 30 minutes. So A is out already because that one rest in bed, whilst the main thing is to stand upright for 30 minutes. So our correct answer here is C, take the medication with water only. Our sixth question is, the nurse is making initial rounds on a client with C5 fracture and a crotch-filled thanks. Which of the following equipment should be kept at the bedside? We have A, a pair of forceps, B, a tag wrench, C, a pair of wire cutters, D, screwdriver. So a client with crotch-filled thanks should be with, like, we should place a tag of wrench behind the bedside, because this one, the tag wrench, allows us to control the amount of pressure that is placed on the screws. For screwdriver, you will not know the amount of pressure that is placed on it. But this tag wrench is a special, screwdriver. Let me say that. It allows us to place a certain amount. So for us to determine the amount of pressure we want to place on that screw. So the correct answer is B, a tag wrench. Okay, so our seventh question is, an infant weighs 7 pounds at birth. The expected weight by 1 year should be A, 10 pounds, B, 12 pounds, C, 18 pounds, D, 21 pounds. We all know that by 1 year, the initial weight should be multiplied by 3 to get the weight which he or she will get by 1 year. So 7 times 3 will give us 21. So the correct answer is D. So this will be our last question for today, so that the next time when we meet, we move from where we stopped today. The question says that a client is admitted with Ewing's sarcoma. Which symptoms would be expected due to this tumor's location? So we have A, myplasia, B, aphasia, C, nausea, and then D, bone pain. We should know that sarcoma is a type of bone cancer. And so if you know that sarcoma is a type of bone cancer, the answer should be obvious to you. So the correct answer here is bone pain. The others doesn't relate to the question. This is where we end our today's NMC questions and answers. Don't forget to subscribe, and also try and send this video to your class group or any nursing student you know. Don't forget to subscribe as well.